Hi, this is Amy Hegel, SHINE Liaison at Senior Connection Center. Today, we have one of our amazing SHINE volunteers, Jim, from Highland County. We know that Medicare is complicated, so we have created this weekly video series so we can answer, some of the questions that you might be having. Today's topic, we're going to be covering Medicare Financial Assistance. So hi, Jim.
Hi, Amy.
And one of the questions that we get a lot is, how can someone afford the Medicare premium if they are on a fixed income?
Well, to start with, the law says that the increase in the Medicare Part B premium each year cannot be more than the increase that you receive in your Social Security benefit. So that helps a little bit. Also, if you qualify based on your income and your resources, excluding your house and one vehicle, then you may be eligible for a program called Medicare Savings Programs, in which case the state would pay your Medicare Part B premium for you. If you don't qualify for Medicare Savings Programs, there are some Medicare Advantage programs in the counties that use some of the money that they get from Medicare to pay some or all of your Medicare Part B premium. So if you're having trouble affording your Medicare premium, you may want to call SHINE, and we can, first of all, see if you might qualify for Medicare Savings Programs. And if not, we can show you the Medicare Advantage plans that might help with the premium.
That sounds wonderful. So another question that someone might have, how can they afford their prescriptions?
Well, there's a federal program called Extra Help with Prescription Drugs. Again, eligibility is based on your income and your resources, excluding your house and one vehicle. If you qualify for Extra Help with Prescription Drugs, the government will pay some or all of your drug plan premium. It will also eliminate the coverage gap or donut hole and substantially lower your co-payments. If you don't qualify for extra help, then many of the medications would be covered by what's called a patient assistance program. These are programs that are sponsored either by the manufacturer of the medication or by certain not-for-profit organizations. And they would help you with the cost of your medication. So these are some solutions that might work for you.
Sounds great. And also another question that we get from our clients quite often, what is medically needy share of cost?
Medically needy, which is sometimes called share of cost, is a limited form of Medicaid for people whose income is too high for full Medicaid. If you qualify for medically needy, then it's designed to cover some of the out-of-pocket costs that you would have that are not covered by your insurance, that are very high relative to your monthly income. You apply for medically needy, you have to do a full Medicaid application, and you apply through Access, which is the Department of Children and Families of the state of Florida. And you can do this one of several ways. You can apply online on the website, and the website where you would apply is myflorida.com/Access Florida, without a space in between Access and Florida. There are also offices in most of the cities in Florida, and the Access has, often they're in storefronts or strip malls, and you can go in there and apply, and there are people there that will help you with any questions that you may have. Also, if you contact SHINE, we can mail you a paper Medicaid application, and you can submit it by mail. Now, in order to be eligible for medically needy, you have to have resources, excluding your house and car, that would be below $5,000 if you're a single individual, or below $6,000 for a couple. If you qualify, then the state calculates what's called a share of cost. And this is an amount of expense, out-of-pocket expense, not covered by Medicare or other insurance, that you have to incur before Medicaid kicks in for you on a temporary basis. Now, the rules for medically needy are fairly complex. So if you think this might help you, then I would suggest that you call us at SHINE and we can explain it to you and help you understand how you can use it as efficiently as possible.
Thank you, Jim. That's a great answer, and explains it very well for those that may have that question. And what about those people that they just don't qualify for financial assistance? What can they do?
Even if you don't qualify for any form of government or other assistance, there are often steps you can take to minimize your out-of-pocket expenses. One of the things you can do if you're struggling to afford your medications is to make an appointment with your doctor and let your doctor know that the cost of the medication is a problem for you. It's helpful when you do this if you obtain a copy of your insurance plan's formulary. A formulary is a list of drugs that the plan covers. They don't have to cover every drug, just a certain number of drugs for each purpose. So if you take that to your doctor's appointment, then that helps the doctor find something that will work for you that would be more affordable. You can also go to a website. There are several websites where you can obtain the best possible pricing without using insurance for the different medications. Sometimes you can actually, with a coupon, get your medication for less than you would be able to get it with using your insurance. So an example of one of these websites is goodrx.com. That's GOODRX.com. You can go on that website or other similar websites, enter your zip code and search for your medication, and it will show you the pricing with various different drugstores. Often you have to print a coupon, but you can do that right on the website. So these are some things that you can do. Another thing that is very important is during the open enrollment period each year, it would be a good idea to carefully review your insurance coverage and make sure that there isn't something that would be more affordable for you in terms of your medications and also the co-payments that you're paying for medical services. If you call SHINE during open enrollment, we'd be glad to help you do this. We can enter a list of your medications and review the various plans that are available in your county so that you can make the best possible choice.
So there are options, for those people. That's an excellent, advice to let people know to review, every year. And also another question that clients might be having, when can they apply and for those benefits and how often?
You can apply for extra help with prescription drugs, which is also called the low-income subsidy. You can apply for that as soon as you receive your Medicare card. If you apply before your Medicare is effective, then the extra help will become effective at the same time as your Medicare. Now, with the Medicare savings programs, though, you can't apply before the middle of the month before your Medicare goes into effect. If you do apply before then, your application may be rejected by Access because they don't think you have Medicare. Each month, Access gets a list from Social Security of people who are going to be going on Medicare the following month. And until they have your name on the list, they would reject your application. So don't apply for Medicare savings programs before the middle of the month before your Medicare goes into effect. Now, if you've applied in the past and they have your application's been rejected because your income or your resources were too high, but your situation has changed and you think you would now qualify, you can reapply at any time.
That's wonderful. And thank you, Jim, for answering all these tough questions. And, you know, as you can see just by listening to Jim, the best resource for all your Medicare questions is contacting a SHINE counselor. So we're here, open. So please give us a call at 1-800-963-5337. And we can connect you to one of our amazing SHINE counselors that can answer any questions related to your Medicare coverage. Thank you.
Thank you.